Okay. Okay. Alrighty. So, greetings, everyone. Welcome to the second webinar. I want to apologize to everyone up front for not being at the earlier one. Did have an executive board meeting with OSAA, but here now, and I'll begin this session. And I want to begin by thanking all GBSD employees who never gave up on our students during one of the most challenging springs ever, and also those who continue to fulfill the important duties to ensure our readiness this fall. And I want them to know that I recognize and appreciate the perseverance and dedication that they exhibited daily on behalf of our students, along with the parents and family members who found themselves playing the role of teacher, counselor, and perhaps principal this past spring. So the purpose of tonight's sharing, well, I hope that the information that we share tonight will be presented that will give you a good perspective of our challenges, the process, and our interests. I want to reiterate and be very clear that this information being shared tonight is only a proposal and in its draft form. Nothing is final. In fact, our governor has another announcement tomorrow, new guidelines or tweaked guidelines, I should say. So we will probably be clearing up some of that tomorrow by the end of the day. At the end of June, we developed a framework for reopening and to assess our reopening readiness and we formed small work groups that are working on things towards SEL and mental health, health and safety, equity and learning loss, workforce and legal concerns, finance, and cost control. These teams are made up of cross-functional administrators, instructional leaders, tech teams, who are all going through scenario planning, availability of resources, guideline changes, and developing readiness diagnostic and best practices. These groups will also make recommendations on the needs for PLCs. As the guidelines change, again, we will need to adjust, and we still need to have input from staff and stakeholders. Today is one of those sessions, or the second of those sessions for today. We've conducted surveys and gathered as much information as possible to ensure that our decisions best serve the needs of our students, staff, and community stakeholders. Our limitations, though, is that we cannot solicit feedback and conduct surveys on every issue we encounter, but we can employ other tools to assist us in assessing stakeholder perspectives prior to the tough decisions. The purpose, again, of tonight is to share information that will be presented. We'll give you a good perspective, again, of the process, the options that we may have, and your interests. And before I turn it over to Lisa, I also want to be clear again that we're keeping safety and health of all employees and students in the forefront as we move forward. Lisa?
Thank you, Superintendent Pereira. I'm going to share my screen and get things set up so people can see this at home. And also, this will be posted and it will be on the website. And if we can't capture everyone's questions tonight and answer, which I know that we won't be able to, we'll have a question and answer opportunity on sending things out to people, and also to make sure that they're on our website. So again, thank you everyone for being here tonight. And we hope that we can give you some overview of the why of our framework and what we have learned so far, and explain to you how we will move forward with getting input from every stakeholder, and especially our GBSD staff members. We want to give you an overview of our webinar, and it's sort of a combination of the things that we've learned from national and international resources around research, and also the Oregon Department of Education's blueprint plans. But we always want to keep the mission and vision and principles of our board at heart. And so we're going to make sure that people see how that fits into our plan as we move forward. We want to share with you the state guidance, but again, the state guidance is always able to be found on the ODE website. And then we want to cover the key elements of things that we've discovered, things that we may be considering as a recommendation. And that includes instructional models and what we know that we need to do to best serve our students. And then finally, we want to have a question and answer session. So make sure that you're submitting questions and comments in the chat, and we will be capturing those to answer at the end. As the team has been working here through June, July, and now nearly into August, we have always kept equity at the center. And I think it's important to reflect on that now as we move into this conversation about kids. We want what's best for our students and our staff. That's why we're talking to you. But we like to have a student in mind as we talk about who we want to make sure that we serve and how we're representing ourselves. We also know that there are very controversial things that come up and how people feel about COVID. So I think it's important that the questions and the comments stay focused on how we best serve our students and how we can support one another during this time. The board does want to continue to inspire and empower students, and I know that we all do feel the same. And our output is really around what we want to see as our students become graduates and into our community. We want to make sure that they are culturally responsive and that they certainly are thriving in an ever-changing global community. And we know that our community is definitely changing during these times. We utilize our Gresham-Barlow School District learning model. And what we found is, even though we started working on these as the inputs to make sure that we have the output of a portrait of a graduate, that they still apply even in the times of distance learning. I think we've really understood the difference now of safe and caring environments and how absolutely important that is, and also how important rigorous and relevant standards and practices are for our students. We want to make sure that you follow the same guiding principles that we did, and that's that number one, as Superintendent Pereira said, is around safety and wellness of our students and our staff. And we certainly are talking to you today and want to express that wholeheartedly. We also want to make sure that you understand the cultivation of connections and relationships and how that really played out in the spring and how that connection keeps our students engaged. We want to center everything that we do in equity, because when we serve our most vulnerable populations, we serve all of our populations well, and that we know that we are going to innovate with all the great things that we learn and the lessons that we have learned from other parts of the country and internationally. So the first thing that we'd like to do is engage you in tonight's conversation. And I know that it's fairly one-sided with me talking at you, but we want to make sure that we have some fast facts coming up. We know there's been a lot of focus on mental health during COVID for our students and families, but dealing with the unknown can be very difficult, even for the adults and the staff of GBSD. So we're wondering how you are feeling currently as you're handling the uncertainties and the changes that COVID brings to us. So the first question gives you 5 answers. Please choose the best selection that meets your needs of how you're feeling right now. We have a lot of things that are uncertain and things are changing every day around COVID. We want to know if you're handling that well, or if it's taking the toll on you, as we want to be able to help and address those concerns. If you haven't done this before, you use your cursor and you just end up pressing one of the choices. So although this is not a scientific poll, we see a bell curve happening where some are doing very well without their summer vacations and taking things differently. Many are doing well. I'm glad to see that we've got 29% of you feeling very well to good. Many of us are in the fair areas where it does take its toll. And then some are feeling poorly or very poor about that. What we want you to know is that, of course, we all have our medical physicians, our counselors that we can reach out to, but we are also putting in the chat the opportunities that Gresham-Barlow School District provides you with our partnerships around support for you and your family during these times. We know that we'll continue to support you with mental health for our students, and we come first to make sure that we are healthy and safe and we're helping our students. The reason why we bring this up is that we have had some research around mental health that's critical to our learning recovery. We have recovery of our students, and we know that being traumatized in the classroom and the fact that we have very tired teachers and staff does play a role in this. So a couple of things just to keep in mind, that we have students that are worried about many things, as we as adults are worried as well. We have 33% of our children worried about contracting COVID or someone in their family, or 19%, or perhaps even higher because of the economic downfall of Oregon, where we've got children worried about meals, food, and the panic of things that they need to buy, or possibly even shelter and home life. We also have some that are afraid to go out of the house, and the fact that COVID just brings on anxiety for those that even have all of their wants and needs. We also have the issue around stress for the adults that can easily hinder instructional quality. The polls say about 60% of teachers that are having health issues affect the instructional quality, and 33% of our students that could return are probably going to have some disruptions in the classroom that we will have to address. It also slows down learning and reduces cognitive processing for our students. So we want to keep those things in mind and make sure that we are meeting our needs first, and some of our professional learning will do just that. Other things that we've learned on the through nations other than ours is that at the beginning of all of this, parents really felt like maybe they wouldn't have their students return, and that they were likely to enroll in online and not even worrying about coming back. Well, when we polled our staff and our students and our parents, we heard that overwhelmingly people wanted to return. That somewhat might be changing at this point because it seems like things are going on for quite some time. At the same time, there was less of a worry about staff wanting to return. We were seeing polls around nations and other states that people wanted to return to work. Now we realize that there are medically vulnerable teachers, and our HR department, along with James and his team, have asked you to fill out a survey so we know exactly who may be vulnerable and what we can do to provide support and the necessary positions if that becomes an issue about returning. We have at the bottom of this slide some things that other districts have done, which is, how about a distance learning coach or a supplemental tutor that checks in and does more one-to-one work online, or a family customer service. All of these ideas are coming from a resource that we're utilizing, EAB. And we set up our planning sessions with a district leadership team, making some large decisions and playing out some scenarios, and then moving forward to see how we were able to work and respond to those. We also are responsible for the grants that are coming our way to support some of the funding necessary for health and sanitary materials, and all of the things that it would take if we return to brick and mortar. And at the same time, we created rapid response teams where we have administrators and instructional cross-functional teams working on 6 general areas, because even though ODE has a blueprint, it doesn't necessarily have all of the things that we are required to put together. For example, financial and cost controls, workforce and legal issues that James and his team work on, teaching and learning that our teams are working on around equity and learning recovery, health and safety, and social, emotional, and mental health. Those things are in the forefront and will also play into our blueprint. What's going to happen next after this session is that we are going to reach out to every one of you. And again, I'll ask that if you would be willing to take part in a PLC, we have 4 areas that we would like to work on with teachers at the building level in elementary, middle, and high school. And those are around special populations of students, additional distance learning supports, teaching and learning, behavior interventions, and teacher burnout and how teachers are feeling about the workload that is before all of us. The critical steps are important to fill out the Ready School Safe Learners Guide, which is the blueprint from ODE. Again, look at that on their website and you'll see that there are samples and that we will be working on finishing ours by August 15th. We also have to constantly look at the local public health authority and the disease management metrics that we're all checking on every day. How many cases are we seeing in Multnomah County? What stages are we in? And what is the governor currently saying? We anticipate ongoing updates and we may see one as early as tomorrow. We also continue to assemble the appropriate personnel and we're doing a lot of research with our colleagues across the nation. Next steps to prepare is that we need to know what the statewide requirements and recommendations are. The ODE plan has many requirements and many recommendations. Of course, we need to meet as many of those as we possibly can to make sure that the safety of our teachers and our staff and our students for health and instruction go forward positively. We also need to make sure that people understand that there are local level decisions being made. Otherwise, we would have a state plan that we just had to go out and manage. But we're putting together a district plan, and then also every building will have some details that are necessary for the building to take on it as well. We also want to make sure that all of this is done before and prior to opening, and that our board approves that, and it goes on to the Oregon Health authorities to ensure that we can move forward. There are 8 sections in this Oregon Department of Education guidance, and our 6 response teams are able to manage all of those. Again, there are sample plans, lots of research, lots of resources, and we'll continue to update you on the progress. We've had many versions already of this, and they're probably about every 20 days updating it all the time. Here are the areas that the blueprint provides oversight, and you'll see that not only is Gresham-Barlow putting equity at the center, so is the state. And it's important that people realize that, and we've been sharing that with our students and our parents as well. There are lots of decision tools. When we're making decisions, excuse me, we are using the decision tree to make sure that we look at lots of different options, and we'll explain in a little bit how we came to decide on a few things and how that was decided. The Oregon Health Authority also puts together a very simple flow chart that says that, can we open this with a hybrid? Can we open in a standalone? Can we open only online? And there are choices because we want to make sure that safety is at the forefront. We continue to look at key elements such as physical distancing. We know that right now we need to be 6 feet apart, and we need to continue to wear masks and keep things safe around that and the distance of others. We also need to keep track of cohorts. It's important that you realize that every time students are together, that's a cohort. So transportation, that's one cohort, a classroom's another. And so we need to make sure that we are tracing who has been in contact with which teachers, which staff members, and what other students. Finally, we have a facilities, operations, and many people working on the cleaning and disinfecting of our schools, and the patterns to that, which will keep us most safe if and when we return to brick and mortar space. The use of face masks and coverings comes up a lot. You can see we're wearing ours tonight because as adults and we're in the same room together, we want to make sure that we're covering those guidelines. But it's also something that we would really ask all of our staff and our kids to use as often as possible. We'll get into that a little bit more as we talk about what's required. We have asked some survey of parents, students, and of teaching staff around distance learning from this spring. And I think it's important that we just quickly go over these, and I'll generalize what we learned from everyone. We talked basically about the type of activities, the type of engagement, and if the work was rigorous and engaging also. What you can hear from parents and guardians is that it seemed to be sort of the typical bell curve where most people thought that distance learning activities motivated our students. We also heard that the amount of work seemed to be just about right. These are hard things to discover as we were going through it in the spring, and I think these reflect the hard work of our students, our staff, and our students. Also, parents, we asked them when we returned to school, and this was in June, what type of return were you best hoping and describing? Most at that time, over half, said we would really like to return to school in person, knowing that maybe other opportunities would be necessary. We're starting to see a slight trend of others wanting more online options. I'll move on to the surveys from the students. Similar to the parents, students felt that their work in general motivated them and their activities were interesting and engaging. We also saw that not very many said that they needed more work, interestingly, but most said it was right about average for the type of environment they were in during that time. And then how often did they receive communication? I'm really proud of the work that our teachers and staff and counselors and classified had really worked with our families, because you can see that nearly everyone daily or a couple times each week were contacted, which is true engagement of our families and communities, making sure that we were meeting the needs of our students. Also, we asked teachers, how did you grow in your understanding of making and creating meaningful and engaging online experiences? And you can see that many people thought they grew and kept learning and kept improving. And then also, were we able to meet the various learners that we have in our classroom? This slowed many districts down because they were afraid that they wouldn't be able to meet the needs of our most vulnerable populations. But again, you can see that we did our best to make learning online accessible for all of our students. And then the feedback. We know how long it takes to provide strong and accurate and meaningful feedback. And you can see that our teachers felt like they really worked on that. And again, Google Classroom and Seesaw and other things really permitted that. Now to the why. We wanted to share with you sort of how we would begin creating an idea of how to fill out this blueprint and what would be best for our community. And we looked at the research. We also talked about what could we afford, what could be practical, what would meet the needs of our staff. And you can see that we learned from some early adopters. This is sort of a chart that shares all of the ways that many districts chose to reopen or maybe reopening now. Some chose early grades, special populations. That worked for many, but for many that meant that upper grades would have to do a lot of distance learning, and we were concerned that the engagement at the middle school and high school levels were very difficult and incompletes were a concern. There are some districts that are doing AB weeks, and we talked about how that really is a strong impact for childcare and actually feeding families. And so we wanted to make sure that we were meeting the needs of our community, and that might not be the strongest way to move forward. We looked at AB days. Now, whether if that's A and B or AA, BB, and those things will come with what days we might end up having as a professional learning day. But we feel like that is consistent. It has a lot of equity. It meets the needs of our K-12 learners. And we saw that it was actually a strong system for Australia and Austria and some other places around even Oregon. Finally, the split day schedule with a lot of different busing, we realized that the funding for that was just crazy expensive, and also that we couldn't find the buses, the bus drivers to meet the needs of our students. So we're looking at a hybrid model when we're able to return to school. This isn't something that is completely finalized because we need to hear from our PLCs, which is you. But we know that we want school to be safe if we enter a school, and that it's safe when we're away from school. We need to stagger schedules, stagger the amount of students, and that we need to have on-site instruction and supplement with technology for distance learning. We are buying quite a few technology and other equipment to make sure that we have enough for at home and at school, and that also includes internet and opportunities for those that may not have that at home. We also know that we have to follow the strict guidelines for health requirements in the setting at school. So a schedule might look like this for a hybrid. And I want to share this with you because there's really three things happening at once. At the bottom, you can see that many of our families and our students have really opted and are stating that they want a full online instructional K-12 model all year. And we want to make sure that is available to our students. We also know that many want to return to school as soon as they can. And so because of that, we will start with a distance model. And eventually, when we're allowed to move back into an A-B hybrid approach, back into the schools. If we're able to have K-1 for more days, that's something that we really wanted to consider, as those are very important years to start on those important skills to get our students through the following years. And either a Wednesday or a Friday for professional learning to continue with our PLCs and working collaboratively together. So there are some problems with a hybrid model, as you know. Childcare can still be a challenge for families, and we mean families in our community, and we mean families as in staff. And so we're going to look at opportunities that we can provide childcare, and currently working with Multnomah ESD and the counties around us that know that they're in the same situation. And there's the issue that teachers are thinking about. How do I manage two worlds? One where students are online and I potentially have students in front of me at a school at the same time. So we want to talk more about the opportunities we have for teaching and learning strategies. So our next poll is about your needs for daycare and childcare. After hearing about the instructional models, under this consideration, what are your family's needs in terms of childcare during the school year? Do you need daily childcare? Do you need some? Do you have an older student that may be able to work and be on the same schedule, or on a different schedule rather? Or do you not need childcare, or you're unsure yet? Take a moment to fill out what your needs are so we can start to look at what we need to help you with. So many of you do not need childcare, but there are some that have daily needs or some needs. Some have older siblings, and many are some are still unsure, and we understand that. This does not mean that it's not a continuing issue, because we see right now there are so many people that have families at home and trying to work, and we understand the strains of that. So we want to support our youngest and most vulnerable students. I just wanted to make sure we were aware of those, that we are looking at extended times and days for K-1, that we are concerned with special education, English language learners, And the students with the largest learning gaps, we know that we had gaps within different populations coming into COVID and leaving COVID. Those gaps got even larger, and we want to make sure that we meet those needs. So again, just to recap, we have two models that we're looking at. The first is the hybrid model, where we know that we want to return face-to-face because that's the strongest learning environment possible. We want our students to continue to attend their regular school, and that eventually we will be able to do a blend of online and on-site learning. We know it's not possible now, and we know that it will take a few weeks or more before the regulations even allow us to move on site. So we want to have a strong start online. We want to really dig into distance learning and all the professional learning necessary for that. We've already gone to the board and asked for 5 additional professional development days for our teaching and our classified staff. So we are well set up to start strong with a distance learning plan. We also know that before we can return to any sort of hybrid, we need safe students in our schools. So after about 5 weeks, we may begin an A/B schedule and make sure that half of our learning is at school and half is at home. That will take some time, and we'll continue to work that out. And then also we need to be ready to be remote learners at any time, not just those that have chosen the online from the start, but anyone that was hoping to get to be on site, but because of other issues, we continue to be at home. The second option is that online option from the start. We've already had families reach out to us to say that that's what they're looking for, and we're looking for the best program, K-12, fully online to support our learners. That is all coursework at home, and then our teachers support the phone, video, and possibly in person. And then we'll have specialized curriculum, and the students will stay in at home. The other things that we're looking at is the Office of Health Authority, the governor's office, the county, and the disease control that really allow us to return to school. So the last question before we move to question and answers is share your thoughts. From what you know about the 2 plans we'd like to move forward with, which is your preference? Would you want to teach online only from the start? Or would you be looking to be able to slowly return and see your students in your classroom and try a hybrid approach? So about 60%, and that's similar to earlier this afternoon. And there are 41% saying that they would like to see their students back in their schools eventually. So with that, I just want to end with our timeline. You'll be able to see the timeline later, but next week we're moving into PLC sessions where we hope to see many of you contributing and giving your thoughts and your questions and concerns. And then we'll move to operationalizing our plan and getting it approved so we can go back to school in some capacity. There's a lot to do in the next 60 days, but again, it's working with you and making sure that everyone is set up and ready. We have 2 webinars for our families, and we'll continue with the timeline of updating everyone as we learn more as we go through this. So again, to keep that brief, I hope that is an overview, and I hope that you see where our thinking is. And I know there are a lot of questions out there, and so I will mute myself, and we have a whole team here to answer any questions that were not answered in the presentation.
Okay, here is one about instruction and distance learning. We might be adding a new learning management system. This was shared at an earlier webinar. The person states, what is the reasoning behind this? Are we still going to be able to use the tools we used in the spring? and which learning management system is being considered?
Learning management systems are something that many districts have already put into place across the state. Canvas happens to be the state adopted learning management system. And the purpose for that is that it's more comprehensive than typical Google Classrooms. Also, Google Classroom is a freeware that we're using now, and there's always the potential for further costs. And so we want to just make sure that we're more aligned to the state itself.
Okay. Will teachers be in their classrooms or schools with the online model?
John, do you want to cover that? The question, and it's operational.
Mm-hmm.
It just depends on if we are able to return to the classroom for that. I know that people want to be with their whiteboards, their manipulatives, their materials, but those are the things that the Oregon Health Authority really have the overall decision making on that. John, do you want to add anything?
Give me the question one more time.
The question is,
Right now, I believe that we can, teachers who want to be there, especially if kids aren't, because adults are responsible for maintaining the social distancing. You would have things in your classrooms you could do. We have a system in place already at the district office where teachers can identify, or staff members can identify if they've been in the office or not, so that the space can be properly cleaned for the next day.
okay, here's a question on instruction. Will teachers be able to choose between teaching online exclusively or the hybrid model?
We're all in the room together, so I want to make sure I unmute, but then you have to hear me. So the question is, we asked the question because we do want to see if people are interested and our teachers are interested in teaching online fully. And people will have options, but it's around the needs of our students and the needs of our teaching staff. HR and Jane had put together a survey and can go into that a little bit more.
Thank you, Lisa. Yeah, we understand that there's going to be a need for flexibility and opportunities for some staff, both licensed and classified staff, to actually work remotely. We're gathering that information, and we will have options for staff, those that can only work remotely and those that can work physically in the building. So we will be kind of putting together a plan once we have those numbers vetted out a little bit better.
Okay, this is related to seat hour requirements. Are there any seat hour requirements, and how will that be measured?
Division 22 and those standards, ODE as well as the governor has been very flexible given our emergency circumstances, and we anticipate that to continue.
When you look at the hybrid model, how will the AB groups be divided up?
We initially talked about how we would like siblings and family members and those that live in the same household have the similar schedules that was recommended. And so we were looking at addresses, even and odd. So transportation and schools would be functioning and running through as typical, but only picking up half the students.
Okay, here's the question related to distance learning. What are the plans for increasing engagement and student accountability if we do distance learning or the hybrid model?
We can all talk about that. But go ahead, John.
Well, that's a responsibility of all of us. We have to continue to look at what we're doing at the classroom level, at the individual student to teacher relationship level, as much as how much are we building our systems at the district level to support you in that work. That is a system-wide group effort that we're going to have to continue to pay close attention to.
Okay, moving on to operations. When we have in-person learning, how will we do lunches?
We have had a number of meetings through July about how to do that. In the end, what's going to likely happen if we are physically in the buildings is lunches will be delivered to classrooms, and so will breakfast as well. We'll ask which students want what that next day that they come. We will prepare those in advance, and they will be delivered to the rooms.
Okay, here's a question. If we are using the hybrid model and Multnomah County is in phase 1, will we be allowed to use playgrounds for recess?
It is highly doubtful at this point, given the cleaning that would need to happen, and we will have to look at recess substantially differently than we have in the past.
And I'll point out that if we are in phase 1, we will not be in our buildings.
For cleaning buses, how will buses be cleaned between different routes for each level, elementary, middle, and high school?
The good news is recent research about chemicals that can be used in the buses less often, but have more impact. We're getting that information now from some of the national school bus service providers. They're doing some pretty good research with the CDC. We're actually hopeful right now that it'll be easier to maintain the cleaning of the buses.
And what will cleaning look like for the classrooms for the ABAB model, especially if students are eating in class?
There, you've hit the big issue with, do you do AA and BB? Do you do AB and AB? And how does that impact instruction? And then how do staff and students get trained on how they maintain cleaning as well? We will not have enough custodians to do everything that we need. They're going to have to focus on touch points during the day. So it again will require all of us taking responsibility for helping to maintain sanitation.
In looking at the hybrid model or the distance learning model, what is the plan for utilizing classified staff?
We're gonna.
And if Lisa is answering that question, she needs to unmute her mic.
I apologize. I'll get the hang of it like the 5th or 6th time. If James and I are regularly meeting, and more people will be meeting with our associations, those are things that we will certainly work with them on. And it's around how can we utilize our staff in a different way, as we're not in the classroom and we're not doing the regular duties as assigned. And we know that everyone's going to have to be looking at things differently. Like the earlier slide, we know that we need more contact at home. We saw that in the spring and it was really successful. Again, there's going to be a lot of chances to be working with our families, our communities, and our students in a different way.
Okay, here is a question related to COVID-19. Will PPE be provided to staff? What kind of PPE?
Yes. If you've watched the national news, a shortage is happening again, given the outbreak increases, and schools are not necessarily the priority, but we have ordered a substantial amount of PPE. Where face masks are required by certain staff members, we've ordered those, although guidance continues to be updated on what meets the standard and what doesn't. I just learned that today. And we are looking at cloth masks for all staff, and we're considering ordering cloth masks for all students, regardless of what the guidance is at this point from ODE.
Okay, here's a question related to someone becoming infected with COVID-19. What is the protocol when a student or staff member becomes infected, and will everyone who has come into contact with that individual be quarantined?
We've had for decades throughout the state and most states a communicable disease protocol. So I'll take you back to most recently the measles and how that was followed. The measles has a 21-day quarantine. We did have a family in our district that was exposed. Staff members that were exposed were notified, and we followed OHA and MESD guidance on who should be sent home and who should stay home and what we should do. It'll be very similar with COVID and the outbreak. The Oregon Health Authority, along with the MESD communicable disease nurse, will guide us through the exposure, what we should do, how we should act, cleaning protocols, and who should be required to stay at home. So we will follow their lead, and they are always very responsive and good at letting us know what we should do.
Here's a question that we all have in our minds. Are students required to wear masks? We're talking about students.
ODE is not requiring, and they're not allowing us to require masks for students at this time.
Okay, this question is related to instruction. What is the plan for specialists, music, band and choir, and physical education?
Those are continuing to be challenging areas. Music, choir, there's a 12-foot, not a 6-foot social distancing issue. It makes running choirs and bands very problematic. And to be straightforward, we don't have a good answer for you yet.
How does becoming ill with COVID-19 affect a person's pay or sick leave?
So we will be following. Okay, we will be following guidelines from Oregon Health Authority, and we're working with our legal counsel. We do have the Corona emergency sick leave that staff have access to, and then we have access to OFLA leaves as stipulated by our collective bargaining agreements, as well as utilization of other types of leaves. And I'll be working with the union leaderships to have that discussion over the next couple of weeks once we get some clarification. But in the governor's current executive order, it is starting to get some clarity around what that might look like. So I have asked our legal counsel to give us some specific information, and then I'll start sharing that with our union representation. And then once we get a little bit more clarity, I'll put it in an FAQ and make sure that goes onto our HR website.
Another person is wondering, in an earlier presentation, you said the number of students occupying a classroom depends on the square footage of the room. So does this mean some teachers will have more or less students because their rooms are bigger or smaller?
There will be some disparities like that, given the circumstances that we're facing. We do have to go with a square footage, and a number of the square footage needed per student is 36 feet. So if you have a 900 square foot classroom, the math is pretty easy to do. If you have some of the larger classrooms and it's an 1100 square foot classroom, again, the math is going to dictate how we fill those classrooms.
Okay, we've talked about COVID-19 and the social emotional health of our students and our staff. Given the pandemic that we're facing, will there be an increase in staff hired to support students, such as school psychologists, counselors, etc.?
We are currently in the process of hiring school counselors, licensed clinical social workers, additional support staff, approximately 7.5 FTE over the course of the next couple of weeks to beef up our social emotional supports for students in our schools. With our staff, people have access to the employee assistance program. And in the other webinar, I actually put the link from our EAP on the HR website into that link, and people have access to EAP as well as a support for staff that need additional.
We also are contracting with a number of local mental health services for our students and looking at telemental health as an option. And then we are developing a framework for support for both staff and students around social emotional learning and mental health. And that is one of the PLCs that you will be able to weigh in on.
Okay, here, the next question is about distance learning. How will the district ensure that all students have internet access during those 5 weeks of online instruction? And if someone is answering that question, I wasn't able to
You
hear
missed
the
the whole thing.
audio.
Sorry. I'm going to say it again. I'm doing my best. We're adding to our technology and some of our funding, and all of the technology that we're buying also has internet capabilities already within the computers, similar to the Bills grant of our middle schools. And so we're ramping that up. And if it's not already in there, we already have a supply of internet access.
When we go back to in-person teaching, will teachers be expected to both teach the hybrid model and online instruction? Will that be divided up?
The way that we're looking at different models, and again, this is one of the PLCs that we will be bringing to discuss with people next week. But there are some techniques and strategies where we utilize our, as we did last spring, our Google Classrooms, where students can reach their materials online as they're at school or at home while the teacher is teaching. We also have some synchronous models and approaches, which would include swivels and other things where we can bring the classes together at the same time, looking at the needs of our grade levels and so that looks different at each level, and we'll go into that in the PLCs.
Here's a special ed question. Will direct testing for special education evaluations be allowed?
We will have to wait for further ODE guidance on that. Right now, we don't have an answer for you.
We have a person who's asking a question that you may not have the answer to. They're wondering why not having the same requirements for schools as stores? Why are they not the same? Does anyone have that answer?
I think the direct answer to that is schools aren't stores. And we have a different mission than stores, which is why ODE and OHA are working so closely together to try to give the best guidance that they can.
Okay, this question is related to our community partners. How will they be managed in regards to PPE, such as sun?
Community partners will be following the same guidelines that we have if we are in person. They'll have the same PPE requirements. They'll follow what we ask them to do. The partnerships are usually pretty strong.
Okay, here's another special ed question and distance learning. How does distance learning affect the process of identifying students for special ed? Students who are in the process of Tier 3 came to a halt. How do we ensure they are not left behind?
It's a very good question and very technical, so I'll give it the quickest answer I can. It's virtually impossible to identify a student with a disability without doing face-to-face and classroom observations. It's just a challenge unless there's some sort of significant medical issue that just preempts all of that. So Michelle Cook has been working and going to webinars with ODE on a regular basis. I'm sure we'll have more guidance in there. If kids aren't in school, I'm not sure we're going to be able to meet those timelines.
Here's a question related to K-1 instruction. One person asks, I thought I heard in an earlier session that the K-1 hybrid model would start right away in September. Is that correct?
You did hear that in an earlier, that was said in an earlier parent session, but as we're learning and you're learning, just like in the spring, guidance and information is changing on a daily basis. Since that time, we've also done a more in-depth assessment of our physical facility, and we wouldn't be able to do K through 2 and do a hybrid K through 12.
A person asks if we want to advocate to the state for more guidance or more funding, who should we contact?
All of the people that we listed on the previous slide, especially ODE, they have a questions, concerns, comments section on their website about COVID. And I think certainly they're looking at that. They bring it to our attention as they're making their updates. And you're starting to see that you can actually see what people have written and what they're asking for.
Okay. It's not surprising people are wondering when teachers will be able to get their computers back.
I will check on that again this week and see where they are with the upgrades. That takes a substantial amount of work, so I don't have a good answer for you right away, but I will check. That's not actually true. Not this week, but I'll check early next week.
Here's a question on the calendar. Are teachers having 2 weeks of in-service this fall? Do we start August 31st and students on the 14th of September?
Do you want to cover that? We do have the timeline, and it is that teachers are returning that time, exactly what you said, those dates.
Okay, we have a question that a lot of people are asking us to address. What is the specific medical protocol that the district has put in place to deal with COVID-19 positive students and staff?
As I said before, the specific medical protocol is individually based depending on the exposure and when the exposure happened. Oregon Health Authority will guide us very directly on each individual case through the MESD, as they always have. It really is situation specific, depending on the number of kids, the length of the exposure, where a kid may have been, a family's involvement. There are so many factors that go into this that they take each case individually. There isn't a blanket, we're going to do this.
That said, I also want to say that we are required, and the guidance from the state requires us to do contact tracing. Like just as students enter the building, we will be keeping a log on every student. We know where class they're in, which teacher they're interfacing with. So part of our job is to screen and log as we go if we're in a hybrid situation, and that's part of the challenge. But then once we have some information about a positive case, then it's as John said, but the requirements are that we will be tracking what our contact is.
Okay, another person looking to the future. After 5 weeks of distance learning, if the numbers of cases are still rising, will we continue distance learning?
Say that one more time.
The answer is yes, we will. The big key is going to be, when does a vaccine come into play? COVID is a disease that's now part of the human condition. It's never going to go away. It's a matter of how do we manage it.
All right, we are at 7:29. And as we've shared, we are recording the chat and using the comments and questions in the chat to inform future communications. And of course, we will have a staff FAQ that we will post and share with staff. So now I would like to turn it over to Catrice to close us out.
Okay, thank you, Athena. Again, I know this was a short period of time, and you definitely have more questions than we have answers for you today. But I will encourage you to stay abreast of what's happening here, because as guidelines change, we will have to adjust, and we will still need to have input. However, we also know that we cannot do surveys the entire time throughout this process. There have to be some decisions that are made. And I want to reiterate to each and every one of you that our county needs to be in phase 2, headed towards phase 3, before we consider any students or staff in our buildings. I want to make that very clear. There were several questions about when we're coming back and when we're not. The best answer and response I can give you right now is we need to be in phase 2, headed towards phase 3, with our numbers declining in order for us to do that. Otherwise, we will be online, our virtual distance learning. And Lisa and her team, the ILT team, the instructional leadership team, have been working feverishly with your building leaders and administrators to plan and prepare for professional development that first week. Someone asked about, I'm going to leave this with this last question about why can't we require students? That is not something that we have the answer to, other than the fact that we have to follow guidelines that are set forth by our Oregon Health Authority, as well as our ODE. We cannot require that for students. However, we will have PPE available for our staff for you to protect yourselves as well, if and when we return to the building. Again, I want to thank you for your time tonight. I appreciate all of your responses. The questions that are in the chat will be captured by Athena. She will compile those, and she will ensure that she look at questions that are similar and create a frequently asked questions list. Again, please stay abreast of what's happening. There are new guidelines coming out tomorrow, so some of what we shared with you tonight may be very different because our governor will speak tomorrow at 11 a.m. issuing new guidelines for schools. So again, I thank you. I appreciate your time and your efforts. And please know that we're going to make our best decisions, the decisions based on what is best for you and our students. I am not interested in putting anybody at health risk at all. So again, thank you for your time and efforts.